And for more on protecting children, I'm joined by Dr. Chen. He's an assistant professor of public health at Yale University and the president-elect of the China Health Policy and Management Society. First of all, China's child protection law was first enacted in 1991 and has seen 2 revisions. What is driving this latest revamp?
So I think there's more incidents about the child abuse and the child bully in school and other violence against the children. So there's a larger and larger demand from both the parents, from the schools and the society to better protect the children.
And as time has gone on, are we seeing just more kids speaking out about bullying and experiencing bullying than in the past? People are taking it more seriously these days.
Yeah, exactly. So, but I think more should be done instead of just looking at the educational sector within that sector, because a lot of things should be bring to a higher level, to the legislative level, to make this to make law and make the law enforcement a stronger one to better protect the children. And we know that children is a very important part of the family. It could affect the whole society. And even for the children alone, the bullying of children and child abuse and other traumas during childhood may carry long-term effect through their development until they are adulthood. So which, according to the latest study, which may even change the brain functioning when people are getting older. So this is a very long-term very new evidence showing that we really need to focus on child development at the beginning of their life and in their early stage of life. And if we pay that attention, that will be a huge benefit and a huge benefit to the society. And I think the Chinese government is doing something really targeting this. For example, the National Healthy China 2030 National Blueprint calls for action to care to the life from the cradle to grave. So that means not only looking at the patients, but looking at the full life cycle to pay more attention to the early stage of life, how that affects later life. And also the health policy perspective, not only looking at the patients, but the whole population. So I think children and elderly are the 2 ends of the life, are really vulnerable to all kinds of assaults in their life course.
And quickly, also under consideration how to deal with minors who break the law. A system is being discussed with addressing delinquent behavior. Is there a need? Have there been more complaints about young teens that get away with bad behavior?
Yeah, this is something I think is also undergoing. And from the young teens' perspective, they have very weak capacity to judge, to discern about the bad behavior and the good behavior. So more education should be done at this level. And I think the schools and the children, they should focus not only on the schoolwork, because currently with very competitive educational system and the higher education and the better school is something the parents and the school and children are all targeting. But if we pay more attention to the psychological, motivational aspects of child development, that will be a huge benefit to children in China.
All right, Dr. Chen, thank you for joining us.